Hello, students. My name is Dr. Samara Rashid, and today I will be lecturing on Chapter 15 from the Modern Dental Assisting Textbook, 13th edition, on preventative dentistry and fluorides. Some of the objectives that we'll be talking about will be discussing preventative dentistry, the effects of water fluoridation on teeth. We want to talk about some of the oral hygiene products available to aid in plaque control and age-related changes in oral health. First of all, preventative dentistry is a widespread term that's used, believe it or not, and it's related to the fact that we are using it to do the practice of caring for your teeth and to keep them healthy. And that includes things like fluorides, placing sealants, proper nutrition, and plaque control. So with fluorides, they come in a topical form and a systemic form. The topical form, as you know, with many kids, maybe in also in adults as well, that it's applied directly to a teeth, sometimes in a lotion form, or rather a gel form, or it's spread on the teeth like a foam. So there's many different ways of placing fluorides on teeth. And then there's, of course, the systemic method, which you ingest, such as in drinking water, maybe even in prescription format. So that's the type of fluorides that can be incorporated into a person. With sealants, that's the thin coating that's applied to those little pits and fissures that are on the tops of posterior teeth, not anterior teeth. And then there are fluorides found in nutrition, and with proper plaque control, you can have, you don't have to deal with decay as much, and that's part of preventative dentistry as well. So there is a little excerpt in the the MDA book. I like to abbreviate it. And that's some of the guidelines that patients are given in regards to how to reduce decay in their mouth and reduce plaque in their mouth. Using home care aids, you want to motivate the patient. You want to assess their needs. You want to instruct the patient how to remove the plaque with disclosing agent. You also want to reinforce their home care. So, I mean, it just gives you a basic summary of the some of the things that are needed in order for patients to practice in order to decrease plaque and decrease caries in their mouth. Okay. Just a little bit of a summary again in your chapter 15 in the textbook, same thing with the same components listed. But let's dive a little bit deeper into the topic of fluoride. Fluoride is a mineral, and it's actually naturally occurs in food and in our water supply. So it's been our main weapon to combat dental caries for more than 40 years. It was developed in the 1950s. And what fluoride does is it slows down that process before you develop caries, which is called demineralization. And so it then enhances remineralization of tooth surfaces. Okay. So the availability of both systemic and the topical format of fluoride throughout life, it gives its most benefits of cavity prevention. But let's go a little bit into the chemical composition of fluoride. So there's something called fluorine. And if you remember in the periodic table, if you go back into your bio, into your general biology, fluorine was on the periodic table. It's a naturally occurring element found in living and non-living things. It basically is a pale yellow corrosive gas, and it's in the halogen group on the periodic table. Because if you remember, the periodic table had different colors, and the colors, if I'm not mistaken, pertains to the different groups that are present. So that's something to consider when learning about fluorine. So when a fluoride ion combines with a sodium ion, which is abbreviated as Na, the compound sodium fluoride, NaF, is formed. And so that is what's used in gels and foams. And then that's on your topical fluoride that we talked about a couple slides ago. And then there's potassium fluoride, or otherwise known as KF, and hydrogen fluoride as HF. And those are also used in dentistry. So you got this fluoride ion, right? And it, I believe, has a negative, a negative value to it. So what it does when it combines with sodium, sodium has a positive value to it. So both of them coming together, then like versus like comes together. So it's just something to think about, but it is a negative ion. So, what are the benefits of fluoride? We have this hydroxyapatite, right? That's a compound, inorganic, and it's normally found in enamel. But when you ingest it, the fluoride ions, they react with it, and it basically goes into the enamel and the dentinal structures that are there. Okay. And then remember those tubules and everything. And even bone, it even incorporates into bone, making them stronger, denser, and more sound. But fluorides are used in toothpastes, mouth rinses, supplements. Okay. But how does fluoride work in general? Well, you have the teeth that develop, right? So there's a pre-eruptive development and a post-eruptive development. So pre-eruptive development, as the name says, is before the tooth actually grows in the mouth or before the tooth erupts. And when before it erupts, it's kind of in a sac, a fluid-filled sac all around it. So when you have systemic fluoride that's present in your body, in your bloodstream, it strengthens the enamel. It gets incorporated into the enamel of that tooth and it makes it more resistant to acid. So it becomes a part of it. Now, what happens after eruption? Okay, so after eruption, the fluoride continues to enter the enamel. So when it's in your mouth, fluoride still continues to enter the enamel and alter the structure of its crystals so that these crystals are then not as soluble. They don't dissolve that easily than the original structure of enamel. Okay, I hope that makes sense. Okay. I think this is just a repeat slide, but again, this is just all about preventative dentistry and the different ways that we can incorporate components into preventative dentistry. And remember, in the past, it was all about treatment many, many, many years ago, but now obviously prevention is key. What are the sources of fluoride, right? We have natural sources, believe it or not, in your seafood, in chicken, tea, water sources, but then there's some that are added to our community water. And then there are some in our bottled water, right? Not all bottled water has fluoride, but some of them do. And that could be a problem with some of the bottled water not having fluoride in them. And then, of course, some dental products have fluoride in them. So just a little bit of the natural occurring ones. You can see at the top here, this is your naturally occurring fluoride. You see there's in eggs, meat, fish, fluoridation of the water, tea leaves. But then on the bottom, they're included in actual dental products, mouthwash, gel, supplements, treatment, etc. So what are the uses of fluoride? It can help in disease modification and prevention, obviously, right? We want to make sure we prevent getting decay or cavities, okay? And then we have antimicrobial properties. So when it's found in your saliva, it can decrease the activity of the bacteria by preventing the bacteria from growing in pathways, by preventing bacteria to going into the metabolic stage. And then we have osteoporosis, right? There's a possible addition of sodium fluoride supplements that could help increase bone mass and reduce fractures. All right. And then fluoride delivery, systemic, right? You could ingest it in the body through water, right? Then tablets, we talked about prescriptions very little, but there are prescriptions like tablets, supplements, okay? Drops, vitamins, natural foods, ingested toothpaste. Hopefully, none of you are swallowing toothpaste. And then there's topical fluoride, the one where you go to the dentist or the hygienist, they clean your teeth and they apply the varnish or a gel or a foam on top of your teeth. Let's dive a little bit into the systemic fluoride. So, in our community fluoridation, our public water system, now I'm not talking about well water. Well water, if anybody lives in an area where their source of water is well water, that's a little different. That does not, to the best of my knowledge, have fluoride in it. However, the public water system consists of 0.7 to 1.0 ppm or parts per million and they are added to water for the maximum effects in the reduction of tooth decay. And then approximately 65% of public water is in the US is fluoridated, but there is plenty of places that don't have fluoride and you can see the difference. However, we do have, in our schools, we have fluoridation programs. We have prescriptions and supplements, okay? And that could be recommended when a child is growing up in an area where their water supply does not have fluoride in them. And usually a dentist in that area that's treating the community pretty much knows okay, pretty much knows that that area doesn't have fluoride or knows the status of the fluoride in their community water. And then, of course, there's natural ones. There are trace elements that are found. I'm sorry, trace amounts of fluoride can be found. Okay, and all of these can reduce caries to some degree. To some degree, we can only do so much. It's just a little bit of a cartoon that you see right here on your screen with the community water fluoridation. Again, children are young, they swallow it, it gets incorporated into their teeth. Um, and then ultimately, those teeth then fall out, and then you got your permanent dentition coming in. Okay. And then also, the saliva neutralizes the acid that's made by the bacteria that's on their teeth, and the fluoride heals the teeth. Topical application, your book dives a little bit into that. And that's, again, applied to the erupted teeth and absorbed through the tooth surface. Sodium fluoride, that's the most common active form that we use in a topical delivery system. And then there is acidulated phosphate fluoride. Okay, that's another topical fluoride. It's a little bit more concentrated than sodium fluoride, but it tends to be a little staining. And then you have sodium fluoride varnish. That's 5% sodium fluoride. Okay. Some of the topical fluorides will continue on. Your book kind of breaks it down a little bit more with the sodium fluoride 2%. It's applied in a solution as a gel or a foam. It's kind of more agreeable when you're tasting. It's not as irritating. And it's recommended when there are composites in the mouth, in the mouth. Because when you have too much fluoride, it can kind of act as an etchant on the restorations. And that's something that we have to be mindful of when we're putting fluoride on composites. Then there's the acidulated phosphate fluoride, 1.23%. It has a greater concentration of a combination of sodium fluoride and hydrofluoric acid. It's used for patients that really need, they really need medication in terms of like they really need fluoride. Okay. So it's used for patients who need increased concentration due to medications that contain sugar, And then we have sodium fluoride varnish, 5%, and that's applied with an applicator brush, and it's commonly used because of how easy it is to use. How easy. It's just a paintbrush. And I think we demonstrated that a little bit in the lab last Friday. It was just a little paintbrush, and you just dip in the little kit that it comes with, you paint it on, and you're good to go. And again, the company brands that you'll often see are things like Vanish or Durafate, okay? And it's used as an off-label, okay, to prevent caries. But originally, it's formulated. Originally, it came as a dentin desensitizer or a cavity liner, believe it or not. That's how it all started. But what are the advantages? What are the pluses of using varnish? Well, we just said it. It's simple to use. You don't have to have a dry mouth. It's okay if there's saliva. So guess what? That's good for kids. There's a longer retention time, so it sticks to the teeth, right? And that's good. I know the patient doesn't like the stickiness, but it's good for the teeth so that the fluoride has a more of an intimate contact with the tooth, despite the patient walking out of your office. It dries quickly and it's slowly absorbed by the body. And then also, oral prophylaxis isn't necessary. You don't have to clean the teeth before application. Again, it's applied to the clinical crown or smooth surfaces of the teeth. It may leave a temporary yellowish stain, but on one application mixes the components in that cup. The varnish is applied and literally dries in 10 seconds. Very good for pediatric kids. But obviously it's used in adults as well. Again, not moisture sensitive. No food though for 2 hours after the application. Brushing is not recommended until the next day. I know kids love it when you say that you don't have to brush that night. Okay. So you can ignore the last statement to see a certain page for Give Kids a Smile. In the past, we used to have Give Kids a Smile Day, and that was just, there was a little excerpt in the textbook that, we had students kind of review because they would participate in Give Kids a Smile Day at our college. But we no longer we no longer sponsor that event. Okay. Other fluoride products, fluoride does come in rinses like Act. I personally use Act mouthwash. You swish for 1 minute daily and then just spit it out. And then of course, fluoride is in toothpastes, most toothpastes. Ugh. So first toothpastes contained stannous fluoride. Okay. But then sodium fluoride was proven to be more effective than the stannous fluoride. Okay. Colgate Total has sodium fluoride plus triclosan, an antibacterial agent. And the ADA has accepted, Colgate Total as an anti-gingivitis, so as an additional effect, not just against caries, but also prevents gingivitis. And then, of course, with the toothpaste is 30%, there's a decrease in caries. But children, however, should only use, not a ribbon, a tiny pea-sized amount, like the size of a green pea. Okay. Fluoride gels like Gelcam, Prevident, those are the brand names. Gels are to be used at home or in the dental office, and they contain higher concentrations of sodium fluoride. This is a little picture of how they look with the Gelcam and the Prevident. Okay, with Prevident, NutriCare is another one. So, just how they look on the bottle or on the box. Then, unfortunately, too much fluoride, you can get what's called fluorosis. That's a sign of some sort of toxicity that's occurring where you just ingested too much fluoride above the acceptable levels. So fluorosis occurs from 6 months, right, to 6 to 8 years old when ameloblasts are developing enamel in the teeth. So go back to your DNA 108 or your dental science course, and you'll remember the ameloblasts, right? They're responsible for enamel. So when the ameloblasts are developing, right, fluorosis, if you're getting too much enamel, fluorosis can occur during that time frame. And that's anywhere from a child being 6 months old all the way to being 6 years old or 8 years old. Okay. And fluorosis can produce a mottled enamel and staining. Most commonly, it affects the central incisors because that's what's developing at that time frame or at that age. So when they kind of erupt, they look a little chalky. And it's not that pleasing. Okay, you could almost see kind of white spots or pitting of the enamel and maybe even some staining. And here you see an example of a little bit of a mottling of enamel. Okay, you can see a little bit of white spots as well. And that's where you have the excessive fluoride. So fluoride toxicity in general can occur if there's a fast intake, a rapid intake in just a short amount of time. Okay. And what happens, it the fluoride compound itself kind of breaks down in the stomach. And so you'll develop what's called hydrofluoric acid, and that can be corrosive. You can get symptoms that occur within a half hour. And then, I mean, unfortunately, death is possible in 4 hours. So there is acute toxicity, and acute toxicity has occurred where a child just simply didn't spit the fluoride after the treatment. So if you're giving supplements, the dentist does have to calculate the weight of the child, right? So you can't give fluoride based, like let's say like a dentist is writing a prescription for fluoride to a patient. You can't just say, oh, they're 6 years old, here, give them this much. No, it could be a thin, frail 6 year old, or it can be a big 6 year old. So, when you're writing a prescription for a 6 year old, the patient has to go onto a weight scale in the clinic. So you do a weight and then you sit the patient down and work on the patient. So often see in many pediatric offices that the child is weighed before they sit down in the patient chair. This is just a little bit of a quick drug guide, just for reference. You'll see that there's a divide between the topical fluorides on the bottom and the systemic ones on the top, and you'll see the brand names as well. Then there's something called chlorhexidine gluconate, which is 0.12%. That's found in Paradex, brand name Paradex, or even PerioGard. It's an anti-infective agent, and it's used to kill strep mutans. Strep mutans is the bacteria that causes cavities, strep mutans. And it's available by prescription. Tastes a little bit like licorice, I've been told. So what is the mechanism of action? Chlorhexidine has these positive charges. Okay. It's obviously attractive to negative charges, right? And the negative charges are present in bacterial cell walls. Okay. So when they come together, it causes them to kind of split, causes the cells to split of the bacteria, causing lysis of the wall and death of the cell. And then it binds to the biofilm and prevents the plaque from attaching to areas. Okay, and that's a good thing. So, what are the uses? Periodontal treatment to reduce plaque levels. But you rinse twice a day with it. It's a prescription. You can't get it over the counter. Unfortunately, it does cause brown staining of teeth. Again, there is a risk benefit ratio. Risk benefit ratio. So when you apply fluoride, okay, you can apply fluoride through, you saw the paintbrush, you saw there could also be a tray, okay? So the tray is one use. I haven't seen this in a while with the tray. So you get this foam because fluoride can be applied from the foam. So it kind of looks like hair mousse, right? One of those bottles. So then you flip this over, or rather, I think it is hard to tell. I think it's not flipped over. You flip this over and you'll go ahead and put the foam in both of these little wells here, and you'll just kind of separate them apart, and then you place them in the patient's mouth. Okay. After you kind of just generally just dry and rinse it, place it in the patient's mouth. You may want to put cotton rolls here and there's going to be a lot of saliva that comes out, but you do put the saliva ejector right there in between and have the patient slightly bite down. But they have to be sitting up, not laying down, and you wait 4 minutes. So 4 minutes is a long time. It's not exactly desirable, but I just want to let you know that this is an option. And unfortunately, the child or the adult cannot eat or drink for 30 minutes. 30 minutes. This is a setup tray for fluoride varnish. Fluoride varnish. And you could see, very minor. You just got your, I believe, your Explorer, your college pliers, and your mirror. Tons and tons of cotton rolls, air, water, syringe tip. And here is your varnish. And I believe this was demoed on Friday, where you just peel this back and there's a little well that comes with, and you dip that brush into it. And this is, I believe, in procedure 15-1, or there's a little excerpt in it in your textbook. And then when you're applying the fluoride varnish, okay, you want to kind of gently rinse the mouth, just overall, and just paint those areas. Go ahead and paint those areas. Um, paint the varnish on, and do it for like 1 to 3 minutes, and give the patient instructions. No eating for 2 hours. Like literally, the patient's going to be like, "So that's it? I just leave?" And you're like, "Yeah, that's it. That's what you do." So because they're shocked that you're not going to take this off my teeth because it's so sticky. That's the issue. But what are the home care instructions, okay, with toothbrushing? We already talked about with the varnish, you don't brush that night, right? But let's talk about in general, how do you brush your teeth? You have to generally place your toothbrush at a 45-degree angle at the gingival margin. So you'll see that right here, not not like you want it 45 degrees at the margin. So you see it's tilted this way. A lot of people just brush left and right, left and right, but that's not what it is. They do it straight on. You have to have it at an angle. Gently vibrate the toothbrush back and forth and roll downward. Sweep away, sweep away. So you want the patient to kind of demonstrate with a dry toothbrush in their mouth. How do you brush? And tell them to hold a mirror and show them how they brush. And they will show you. But it is your job to tell them about the proper method, the proper method. So in general, there are several methods, believe it or not, to toothbrush. There's the Bass method, modified Bass, Charter method, Stillman, and Phones method. The dental professional will recommend the method that's best needed for the patient. So not every method is there's not just one method. Okay. You have to think about what is best that suits the patient. Okay. The patient should be cautioned though about damaging, okay, damaging by scrubbing too hard, damaging the gums, damaging the teeth. Look at the picture here. This is what happens, believe it or not, when you brush your teeth too hard. When you brush your teeth too hard, the gums start to wear away like this. And when they wear away like this, then the roots underneath the gums start wearing away. You can actually see a little bit of the pulpal nerve underneath, like just a shadow of it. And that's not good, right? That's not good, because what's going to happen here is with time, the patient will start to develop sensitivity. sensitivity in these areas because now they are exposed and they were not meant to be exposed for the mouth. All right. And remember, what you lose, you don't gain back. This is kind of like, if you brush your hair, like literally brushing your hair bald over and over and over again. It's very similar to that. Okay. So improper brushing can abrade. Notice the key word, abrade the tooth surface, right? And we call this abrasion. Abrasion. Then we have flossing. Okay. Now with flossing, it removes bacterial plaque. You do this before brushing to remove the plaque. Okay. And then the dental floss is kind of in a circular shape. Okay. The dental tape is kind of flat, so they're kind of different. You'll see that when you go to a pharmacy or when you go to your local grocery store like Harris Teeter, the dental aisle, you'll see that there's two kinds of flosses mostly. One has more of a tapered flat, like tape, and one has like literally almost looks like string, but it's circular in cross section. No matter what, they all come in different flavors, their colors, their widths, and some of them are waxed and unwaxed. It's the same effect is with waxed or unwaxed. I personally like waxed because I like how it could slip between my teeth. But again, it's a preference. But you hold the floss between your thumb and your index finger. You wrap it around and you work the floss gently between the teeth in a sawing motion. A sawing motion. So you don't want to pop in and pop out. You want to kind of avoid that because you could damage the gums underneath. Okay. Curve the floss around the tooth. Pick which tooth you want, curve it around, and then drag it out. Okay. Slide up and slide down, but drag it out. Then you got to floss the same area again, but wrap the floss around the tooth in a C shape against the other tooth. So literally you're putting it in the same area. You're just doing a wrap in the different direction and coming back out again. I hope that makes sense. Okay. So you'll see here, you cut a floss around 18 inches, just enough, not enough to cut the circulation around your fingers, but just enough to wrap it around so you have a good anchor. Use your thumbs to split them and start making that C shape and kind of gliding it in between the contacts and wrapping it around as a C shape against a tooth and then taking it out. Okay. You may want to use a mirror showing the patient because they can't see how you're doing it. So they hold that big mirror while you're doing it for them. And then they will demonstrate for you. Okay. Now, patients come in with all sorts of things. Okay. As you know, they'll have implants, as you see down here. And with that, the floss is a little bit more thicker. Okay. And then you'll see up here people with wide perio spaces, big, triangle spaces in between, that the floss will be thicker. Maybe you'll even use super floss, which there's I think like a harder piece of plastic the floss is attached to. You go through it and you floss right through it. Same with braces. Okay. Because you can't floss through that, but you got it so clean in between. Same with bridges, fixed bridges. You'll go under the bridge where the pontic is. And same with denture retained implants. Okay. So you'll see you go through under the denture itself. Nothing can be ignored. Okay, this is just a picture of the dental assisting helping the patient with flossing. I hope this helps. And feel free to contact me if you have any questions. Thank you for sharing.